They laughed when she applied. They said her accent was too strong. Her degree wasn't enough. Her country wasn't advanced. But what they didn't know was that she was about to save their lives. Her name was Dr. Angela Cruz, a Filipino doctor who once cleaned hospital floors in London because her credentials didn't meet the standards. Yet within a few years, she became the name on everyone's lips. The doctor who changed how the world saw Filipino healthcare workers. It all began in a small town in Batangas, where Angela grew up watching her mother, a nurse, care for people even when they couldn't pay. She remembered her mother saying, "Anak, healing isn't about money, it's about heart." Those words stuck with her forever. Angela graduated top of her class from the University of the Philippines, but when she moved abroad, she was told she'd have to start from scratch, redo exams, take new licenses, prove herself again and again. It was humiliating. She went from being a respected doctor in Manila to cleaning wards at night while studying for exams during the day. One night, a senior doctor told her, "You Filipinos are hard-working, but not quite at our level." That sentence burned inside her. Instead of anger, she used it as fuel. She studied harder, took every exam, passed every test, and one day, the same doctor who doubted her came running to her for help when his patient suddenly collapsed. Without hesitation, Angela took over calm, precise, fearless. She saved the patient's life. When she finished, the doctor stood there speechless. That day, he didn't see a Filipino doctor, he saw a hero. But Angela's story wasn't just her own. Thousands of Filipino nurses and doctors around the world were going through the same struggle, questioned, underestimated, overlooked. They said Filipino nurses were just assistants. But then COVID-19 happened. Hospitals in New York, London, Milan, and Riyadh were overwhelmed. Doctors were exhausted, nurses were quitting, and the world was on its knees. And guess who stepped up? Filipinos. They worked double shifts, sometimes with no sleep, treating patients no one else wanted to touch. They comforted strangers as they took their last breaths. They sang lullabies through face masks. The world started to notice. In 2020, the UK's National Health Service revealed that nearly 1 in every 5 foreign nurses came from the Philippines. In the US, Filipino nurses made up 4% of all nurses. Yet they accounted for 30% of COVID deaths among healthcare workers because they never abandoned their patients. People began asking, who are these Filipinos? Why do they care so much? The answer was simple. Compassion runs in their veins. It's in their culture, their families, their faith. In Dubai, a Filipino nurse named Jonathan became famous after saving a baby during a power outage. He used his phone as flashlight and manually pumped air for 30 minutes until electricity returned. In New York, Nurse Lee became viral for holding the hands of dying patients when families couldn't visit. In Rome, a Filipino surgeon rebuilt an entire hospital wing destroyed by COVID because no one else would take charge. They weren't just qualified. They were extraordinary. Even world leaders started to take notice. In one UN speech, a delegate said, "If the world had the heart of a Filipino nurse, there would be no crisis too great." But behind the praise, there were still painful stories. Filipino healthcare workers were often underpaid, overworked, and underappreciated. Some faced racism. Others were denied promotions despite their experience. Yet, they stayed. Why? Because to them, healing is not just a job, it's a calling. One story spread across the internet: a Filipino nurse in London who worked 16 hours a day but still sent half his salary home to support his family in Cavite. When asked why, he said, "Because they sacrificed for me first." That's the Filipino spirit. Selfless, loyal, full of heart. And that same spirit was what made Dr. Angela Cruz rise again. After years of working silently, she was promoted as head of emergency medicine at one of the top hospitals in the UK. The same place where she once mopped floors. Her first decision as head, to create a program that trained and supported foreign nurses and doctors, especially from the Philippines. She said, "If they gave me a chance, I owe it to my people to open the door wider." Her program became a success. Within a year, dozens of Filipino healthcare workers passed international exams, got promoted, and proved their worth. Angela was invited to speak at a global healthcare summit. The audience was full of executives, professors, and world-renowned doctors. But she began her speech with something simple. She said, "They said we weren't qualified, but when the world needed saving, it was our hands that held the line." The crowd fell silent. Then she shared stories, not of herself, but of others. The nurse who sang to calm a crying child in an ICU, the doctor who treated patients for free in a war zone, the caregiver who comforted a stranger like her own mother. She ended with these words: "Qualification is not written on paper. It's written on how many lives you've touched." The applause was thunderous. Reporters rushed to interview her. News outlets called her the Filipino doctor who changed the world's mind. And soon, countries began actively recruiting Filipino healthcare workers, again this time with respect. The story of Dr. Angela Cruz became a symbol of humility, excellence, and pride. But even as the world celebrated, she remained grounded. When asked how she felt about her fame, she said, "I'm not the story. Every Filipino doctor and nurse out there is." She returned to the Philippines one summer to visit her old town. At the small clinic where her mother once worked, she donated new hospital equipment. The staff gathered around her, emotional. One young nurse told her, "Ma'am, because of you, I didn't give up." Angela smiled and replied, "Then I did my job." Outside, children played on the dusty road. She looked at them and whispered, "Maybe one day, they won't have to prove they're enough. The world will already know. And maybe that's the real victory. Not fame, not awards, but dignity restored." Today, Filipino healthcare workers are known around the globe for their skill and compassion. From hospitals in the Middle East to clinics in Canada, their hands save lives every single day. They are the quiet backbone of the world's medical system. They didn't just shock the world, they healed it. Because when others doubted, they delivered. When others gave up, they stayed. And when the world needed heroes the most, they were already there, wearing scrubs, holding hope, speaking softly with Filipino warmth. So, to every Filipino doctor and nurse, this story is yours. The world once questioned your worth, but now it stands in awe of your heart. You prove that greatness isn't about where you came from. It's about how deeply you care. And you cared enough to change the world.